Depressed mood is an emotional reaction or a feeling that we all experience in our lifetime. Feeling sadness, upset, lonely and empty at a time when you're going through difficult life experience is part of being human. The important thing to know is that people bounce out of these moods and then it doesn't affect their day-to-day life. Depression, on the other aspect, is a clinical condition wherein the person has difficulties in bouncing back out of the depressed mood, and importantly, the depressed mood would last continuously for several days at a time, along with loss of interest in previously enjoyable activities, feeling tired and exhausted when you haven't done much, having disturbances in sleep, waking up 2-3 hours earlier than usual, losing appetite, and losing concentration and memory. All in all, the person has great difficulties in functioning at work, functioning in relationship, and functioning in social setting. When these features begin to last for 2 continuous weeks and is having significant impact on one's life, that's when alarm bells must start ringing that this is clinical depression and it requires further intervention. Depressed mood can be caused by minor life experiences such as change and upset, difficulties in relationship and so on, which passes spontaneously as things get better. But clinical depression occurs in context of major life events. For example, in women after a childbirth, in both men and women after diagnosis of major illness like cancer or heart disease or stroke, or it could be in context of significant life stressors or change, for example, being fired from work, losing the finances, or in context of loss event, loss of partner by separation or divorce. Anything that has significantly affected an emotional being of a person and has threatened his security can bring about clinical depression. One must understand that people who have genetics or family history of mental health problems or depressive disorder are at higher risk of developing depressive illness. It is not an automatic risk, but it's a higher risk. So people who have this history must be aware of such a risk factor. I think once you realize that the depression and the sadness and upset is not passing, and you're experiencing a number of symptoms of clinical depression, which is having significant bearing on your existence, on your functioning, on your relationship, then you should consider seeking help. In most cases, depression can be treated by primary care physicians or general doctor who can screen you for depression and commence you on antidepressant medication where necessary. In some difficult, complex cases where they haven't responded to medication, you must consider seeing a specialist, which could be a psychiatrist or a psychologist, who can then systematically look into your difficulties other than your symptoms and then plan interventions, which could be specialized psychotherapy or medication. There's a lot of evidence to know that if you provide psychotherapy and medication as a combination, then they are more effective than either of them alone. Most importantly, you need to understand that depression is common, it's treatable, and most people recover completely.